I'm Kelley, and Jeana is joining me again this evening to answer some vaccine questions. We just wanted to give you some updates from our COVID work, as well as to talk to you a little bit about what our goals are as we go into this first quarter of the new year. We will be hosting a Facebook Live every other Wednesday throughout the whole year. So we're going to alternate our Facebook Lives with the Stats with Sarah on alternating Wednesdays. We will also record these and have them on our YouTube channel as well. Our goal is to keep you updated and with not only COVID-19 information, but also public health topics just in general, anything and everything public health, to help you get to know a little bit more about what we do and the kinds of things that are impacting our county. So just to start with, we're going to do our COVID update, which is we have a total of 17,726 cases. Of those, 220 new cases were reported since our last report, so the last 24 hours. Today, we reported 17 additional deaths. Those deaths happened within the last 6 weeks. That brings our total to about 150 for a total. And we are still in the red status. Our 7-day rolling average is at 68.89, which is back up from last week. So as we look forward into this next quarter, we're planning not only for COVID, but as well to start trying to figure out where we're going as an agency and how we're going to start implementing some of those regular public health measures that we do. So part of this is going to be looking at continuing our data analysis and making sure that we're getting you guys information and updates in terms of our numbers and our vaccinations, and the Stats with Sarah will help with that on our Wednesdays, but she's also going to be giving information on things like the flu and some of the other data that we collect in the community to be able to share that as well. We are going to promote mitigation strategies with our communities, schools, and businesses. So again, just helping folks to remember what are those things that we're really trying to get everybody to do as a collective to help keep everybody safe. So social distancing, wear a mask, wash your hands, stay home if you're sick. So as we move through these past few holidays and we're starting in on the start of the new year, those things are still just as important as they were. And then finally, we're going to be doing vaccine planning and distribution to the community according to the state plan. Sorry, getting tongue-tied here. We have internal teams that are working every day to plan those vaccine clinics and the distribution. So as the state opens up each of the new tiers that are applicable for people within our community, then those plans will start to be set into motion to be able to do vaccines. Speaking of vaccines, Jeana, do you want to take that next?
Yeah, so we have a lot of information. There's still a lot to come, but I can let you guys know where we stand now. So the agency, Jefferson County Health Department, is an approved vaccinator, but we currently do not have any vaccine in stock. The state has really prioritized getting it to the hospitals and that healthcare system and to the pharmacies for the long-term care facilities. That's kind of priority one. So at this time, we do not have any vaccine in stock. We're working through the state. We will be placing our first order shortly. Most likely it's not going to arrive to us until the end of July or January, I'm sorry, end of January, beginning of February. But we are working through that process to make sure that our order is sitting out there waiting as soon as the state approves us to receive our allocation. And part of that is we rely on the state for a lot during this COVID response. They are the ones that are placing those orders for all of the agencies. They determine when we can order, what we can order, when it will be shipped to us, and that allocation. So just like us, we're going to put an order in and expect to get a large percentage of it. They do the same thing. Whatever they receive, they have to allocate across the state and make sure that it goes to those populations that need it most. So we're a little bit at their mercy waiting once that order gets placed to the exact amount that we're going to receive. And that makes it a little bit difficult when people want to know how much we're getting and where we're going to be, because we really rely on waiting until that vaccine actually comes in or we're notified of how much we're going to receive. We are still in phase 1A. We will remain in phase 1A. Sorry, a little technical difficulty here. We will remain in phase 1A as I say it backwards, as a state. And that is because we want to make sure as a state, everybody in that phase has the opportunity to get vaccinated before we move to 1B. And we know some of our smaller counties may be able to get through their 1A really fast, and our larger counties may not. So we're really working as a state to make sure that everybody has the opportunity to get vaccinated. There are plans in place that once one county is done, they can redistribute to where it needs to go. So we're really trying to get through 1A as fast as possible. But to do that, we have to work as a state. So as soon as the state says we are ready for 1B, then we will go to 1B as well. But currently we are in 1A.
Sorry, I have to work with my mute here now.
I had to go to my next page.
You got it?
Yep, I think I covered all my points, yes.
So again, just as Jeana said, one of the things, our staff is in constant communication with our local partners and in Jefferson County, as well as our regional, state, and federal partners to look at the vaccine rollouts. There's been an immense amount of planning that's taken place prior to getting vaccine in-house. So that way, once the vaccine does start to be able to be ordered and begins to flow within the community, we can be very efficient in going ahead and getting that out to the community. So we had some questions that were submitted ahead of time that Brianne has gone ahead and queued up for us here. It looks like we've received a lot of questions about when people qualify for the vaccine, specifically those who are age 65 and over and with comorbidities. They want to know when they can get the vaccine, where it will be offered, and how they will be notified. So short answer is based on the reasons Jeana just mentioned, we don't have dates currently. The state determines when we are able to move from one phase to the next phase, and we are not allowed to move forward until the entire state reaches the end or completes their first stage. So at this point in time, I've heard that the medical facilities and healthcare facilities are doing pretty good on getting their immunizations done and the vaccinations out to their initial groups. Some have started their second shots, and the long-term care facilities are also in that 1A group and have started their immunizations. And so as they work through that process and get that initial grouping done, the state will come back to us and let us know when we are eligible. One of the reasons why JCHD is not part of that initial push as far as healthcare personnel is we don't have the freezer capacity to be able to hold the ultra cold storage. So Pfizer is what is available right now. All of the 100% of Moderna is being shipped to the long-term care facilities. And so once those facilities are able to get caught up and have everybody reach their goals, then the Moderna will be released to other providers. So we're hoping for maybe end of month, beginning like maybe mid-February, but we really tend to, it's very difficult to put a target date on that just because we are really truly at the discretion of how things are allocated by the state. We are putting out a survey though to gauge public interest in receiving the COVID vaccine. So that will be coming out on our socials, I would assume, probably with Brianne pushing those out. But it's going to help us with our planning efforts to know, how much vaccine we will need in particular areas of the county, so that as we're setting up our clinics, we can be prepared for what we're going to be walking into. Jeana, I'm out of practice at this.
No, it's like a brand new year. Forgot what we were doing. So the next question is, why do first responders not qualify for phase 1A since they are face-to-face with patients all day? So there's a couple pieces to this. We follow CDC guidance. You hear us say this all the time. The CDC put out that initial phase, and it was at their recommendation how those phases are rolled out, and they did not put those first responders in the 1A. I think the largest reason is just because we knew that the amount of vaccine we were going to receive was going to be not all that we needed at the very beginning. So they had to make some choices on how do we prioritize even within the most prioritized group. And that's, I think, how it went to that healthcare and the long-term care. They made that decision that those were going to be #1 priority. The CDC has, I believe it was yesterday, late last night, changed their recommendation and added EMS to phase 1A. We're waiting for the state to come out with that guidance. We move as fast as we can, but they need to go through all of their paperwork, go through their all of their processes before that state phase can change. So we watch that constantly, and we will follow it as soon as we're all assuming it's going to be changed. If that gets changed, we will be right in there with that 1A and having first response or having those EMS personnel in there. I expect that to come out within the next week, maybe week and a half, and we'll see how that changes. If it's just the EMS, if they add any other of those first responding agencies to it. But whatever the state puts out, that's how we will follow that that rollout plan as soon as we have the vaccine in-house.
So another one of our questions dealt with the time frame when teachers would be able to get the vaccine. And as of right now, teachers and educational staff are listed in phase 1B of the state distribution plan. So that's the next round of individuals who would be eligible for vaccine. But again, doing healthcare workers and long-term care facilities first. We don't have specific timelines, but as we get information, we're going to be pushing that information out through our education task force, so to the schools, so that they can get their staff and groups set up for vaccination clinics as soon as we are able to.
Next question we have, are we protected after the first injection or not until after the second injection? So it's important that everybody returns for that second dose to develop the highest level of protection. Patients who, if you cannot receive that second dose, Pfizer is at 21 days, Moderna is at 28 days. If for some reason you do not make your 22nd day to make it in to get that vaccine, we still recommend you get it as soon as you can. So there isn't that small window. We want it as soon as possible. You can't come in any earlier, but we want you to get it as soon as you're able to. Part of that is that effectiveness that is quoted in the studies. That number comes after the second dose has been administered. So we want to make sure that everybody gets 2 doses in. And in our ordering, that second dose is held. So we are guaranteed that second round. So I don't want anybody to have to worry that they're not going to get it or think that they need to save that one for somebody else and kind of share their quota. For every vaccine we order, we are allocated that secondary dose. So we want to make sure everybody gets it, and that will come to us. So we will have it in stock. If you come and you get your vaccine from us, we will have your second dose. That's kind of important as well. If you go to a different agency for your first dose, that's where you need to go to get your second dose. We want to make sure if you have Moderna, you get Moderna and you stay with your same that same manufacturer, but you also want to go to the same agency because they're the ones that were allotted your second dose. So you may run into trouble if you try to go somewhere else. They may not have an allocation for you. The next question, when are you going to be setting up community vaccinations, especially for those with underlying health conditions? So again, we don't have specific dates for any of our clinics at this time. We are reliant upon which phase we're in, and what our allocation is from the state. As soon as we have that information, we will post it. Our overall plan is to make sure that we have large community vaccination clinics monthly, and then scheduling smaller clinics throughout the month. As soon as we know what that looks like and we know which vaccine we're going to receive, how much, which phase we're in, we'll be able to put those schedules out. And our goal is to have that scheduled into the future so that you can go to our website and see, here's where we're going to be. every time we hold a clinic, we have to have a second clinic for that first clinic to make sure that we get secondary doses to everybody. So that's part of our planning as well. So we will try to make sure we plan out at least 28 days between those large clinics in some fashion, so that when you get your first vaccine, you can come back and get your second vaccine with us.
Sorry, still getting the mute button there. So the last question that we had proposed was, when will it be available and who will disperse the vaccine? So right now, the individuals or the agencies that have access to the vaccines are the hospitals and the pharmacies. So there are two larger pharmacies, I believe it's CVS and Walgreens, that have been given the vaccines to coordinate efforts for our long-term care facilities. So they're going out and actually doing on-site immunizations for them. And then the hospital systems are trying to do it so that they can get the healthcare staff done. Once those needs are met, then additional vaccine will be dispersed to other providers within our area. That, to my knowledge at this point in time, I believe there's going to be 3 distributors of vaccine. So I believe it's Jefferson County Health Department, Comtree, and Mercy. So again, with that, each individual agency will likely have individual different specifications of how that vaccine will be rolled out, but all of us will be following the state plan. So we're all following the state tiers. It will always be, we'll have to all follow the 1A, 1B. Again, we've all been approved by the state at this point in time. So it's just a matter of having your order in and waiting for them to be able to send that distribution of vaccine as soon as they can send that out to us. I saw a note come up in the chat. Jeana, was that? Do people with comorbidities need to prove they fall into that category? That has not been something that I have heard as of yet, but I know that that's been a question that's been asked. Have you heard?
It has. We've discussed it, and this is not a final answer, but I think the general consensus was that once we get to the point that we're not in that 1A, when we're in 1B, we don't have a system to make people prove that they have what they say they have. So I'm not exactly sure how that will roll out. I think at this point, we're just going to have to take people's word for it, depending on where they fall into that category in that phase. But I have not seen any paperwork or documentation that's been required to prove those comorbidities.
Okay. Well, I think that was all of the questions that we had submitted today. We wanted to thank you for joining us and let you know that next week we will have Stats with Sarah again on Wednesday. In the meantime, for our latest updates, please go to www.jeffcohealth.org, and you can also send us a message or to our communications team, and we'll follow up with you as soon as we can. In the meantime, thank you everybody for joining us, and have a good evening.